Hi, everybody. I'm Dr. Elizabeth Beauger. I'm the owner and CEO of Mountain View Veterinary Hospital in Denville, New Jersey. And this is Christy. Christy is our pet care operations manager. And I'm so grateful that she agreed to be voluntold to come and help me with this today. Today, we're going to talk about some pre-visit pharmaceuticals. And it's a very long word for just saying that we are going to talk about giving some medications prior to your pet's visits to make that visit a little bit more smoother. And this came up several times now because we seem to be seeing more and more pets who are anxious, and it's causing a lot of problems, both for the owners and the animals and the team as well. So what we're going to be covering today is we're going to have an overview of anxiety in general, what it looks like, and the importance of addressing it before it starts to escalate, because those are the dogs who come in and they're howling and they're thrashing, and it's a terrible experience for everybody all around. And then of course the goal for this is that we can have that relationship between you and your pet and make it a smoother visit for everyone, so you don't have to dread your visits coming in. You're like, oh God, I got to bring them in, I know what it's going to be like. There's going to be a couple of examples kind of peppered throughout this talk. I will never forget, there's a gentleman who came in. He came in as a referral, and he was literally sweating bullets because he was so worried about this pet. And it went beautifully. Everything went great. We went slow. Everything was good. But, it occurred to me at that time that you guys are experiencing a great deal of stress associated with this too. And there are things that we can do to help that. So right now, we're going to talk about anxiety in pets and what it looks like. A lot of people don't realize that when your pet comes in and they are at that point where they're not even hearing you, they're just completely gone. They're off their rocker. They're having a panic attack. They're literally having a panic attack. And I don't know if you've ever had one before, but it is a terrible feeling, and you truly feel like you're dying. It is a terrible, terrible feeling. And that's how bad it is for them. It's not just that they're upset. It's pretty advanced. There's all kinds of triggers that cause these pets to become so anxious. It could be interactions with humans that they aren't familiar with, traveling, just going in the car. Cats in particular aren't necessarily accustomed to traveling in the car. New environments, past trauma. We get these dogs that have come out of kennel situations and they don't know what to expect. They only have their previous history to reach back on, and they're kind of like, they're unsure of how things are going to go, and they're not happy with it. Without intervention, these anxiety problems get worse. They don't just go away. So if you come in and we have a pet who, okay, well, they weren't exactly great for the visit. Next time they come in, it may be much worse. And then after that, worse and worse and worse, until they get to the point where, we have to wind up sedating them. And, that's not the way that we want the visit to go. Also, just looking at it from a pure standpoint of the physical exam, we can't do a proper physical exam when they're like that. They're all anxious, they're stressed out, their abdomens are tense. I can't feel inside the belly. They have a muzzle on, so it's difficult for me to examine the mouth properly. Yeah. It's just...
Either the information is not as accurate, or it's just not able to be obtained. We're just getting the bare minimum.
Right. And then, of course, we're doing our best to try to get the pet off the table. So we're pushing through your exam, and that's your time. We want to make sure that you get the benefit of all the time that you were entitled to. The physiological impact of anxiety is significant. I mean, you'll see the increased heart rate, you'll see the panting, you'll see drooling, vocalizing, expressing their anal glands. Yeah. You can't work in a veterinary hospital for more than a month without being showered with anal glands at one point or another. And that's not something you want to experience either. And yawning. We just had this the other day. There's a dog that came in and he was yawning, and the mom was like, oh, you sleepy? And tired? I'm like, no, actually he's not. He's letting the rest of the pack know that there's a problem. He's like, oh. So,
there's rolling on the side too. Sometimes people think they want their belly right. They do not.
They do not. They're like, please just make it stop. I just want this over with. GI distresses, cats. They'll urinate, defecate in their carriers. Dogs will too sometimes. And then, of course, all this chronic anxiety leads to this learned fear response that only escalates. It builds on itself, and it gets worse with time. The escalation problem Yeah, that's a big deal. Perhaps you have a puppy and the first couple of visits went great, and then the puppy's starting to get older and maybe doesn't have great socialization. And then they come in, and let's say they come in for their spay, and they have this experience where they're very frightened. And the next time they come in, they're even more frightened, and it just gets worse. So it does wind up compounding on itself with repeated exposure. Over time, a mild stress response turns into that dog who's thrashing and vocalizing. So without intervention, these kinds of things will lead to the point where we have a pet that needs to be fully sedated, which it's terrible to have to do. But on the flip side, we do for the best to keep your pet out of stress as much as possible. But we also have to do it for our team. We get a lot of injuries. Those nails on those dogs, all of us have a scratch or two, or along our belly, or on our arms, cat bites.
Yeah.
You were mentioning about the cat that bit.
Yeah, we had a cat by one of our team members, and she had to go to the hospital. She had an infection that was affecting the tendon in her hand, which could be a long-term issue. If not treated in a fast time manner. And these especially with cat bites, the infection can set in so quickly, and basically they could be out of commission. I mean, in best case scenario, they're out of work for a couple of days. I mean, that's a pretty significant effect from one cat bite, so it can be serious.
What are pre-visit pharmaceuticals? Yeah, it's a long name. Sometimes we'll call it PVP. Some of you may have come in on a visit and maybe the visit didn't go as smoothly as we had hoped. So we'll say, hey, why don't we talk about giving these pre-visit pharmaceuticals? They typically include things like trazodone, gabapentin. You can also use alprazolam, dexdomitor, excuse me. But these are always used best when you're using behavior modification. There is no single drug that's going to help everything. Behavior modification is the key. It's just like people who are taking anxiety medications, it works best with talk therapy. You have to do the two together. Not that I'm saying you need to sit down with your pet and have a little chit chat about what how they grew up, but you do need to make sure that you are having calming techniques, which we can help you with when they're coming in. We use a lot of bribes, a lot of peanut butter, squeezed cheese, good stuff. Oh,
Muzzle training too, like
puzzle training.
Yeah.
Muzzle training rather, excuse me. All kinds of treats. We also use a lot of pheromones. You may have seen, if you have your cats come in, we use this fill away spray. This is the Gigundo economy size. Most of them are kind of on the small side, but we'll either spray our hands, or we do a lot of the stuff before you guys even come in. We'll spray the towel. Sometimes we'll put it on a paper towel and put it in the crate for you, for them, just so that they can kind of relax a little bit.
Hands, gloves, the scale, we kind of cover it all.
Yeah, we've got lots. And then there's also one for dogs too. This one's called Thunder Ease. There's really only two really good products that, plug, not plug. I'm not sure exactly which company makes them, but they're very good, and you can get them yourself. So these are, when we talk about PVPs, these are medications that you give before the visit. And sometimes we'll say give them 2 to 3 hours before coming in. A lot of times we'll say give them the night before and the day of. That really seems to work the best. They must be given as directed. We're going to talk about that in a minute. Again, we talked about combination with behavioral modification, because no one pill is going to do the trick. The other way that we use a lot of pre-visit pharmaceuticals are in surgery.
Yeah.
Christy's our surgery manager as well. So she's, you go ahead and tell us the difference that you see when they come in. We can tell when you've given the meds or not.
I mean, I would say like 99% of the time, I know when they've gotten their meds. So we give them a little something we call a comfort pack before surgery. If your pet has had surgery here, you probably receive this, and it's a set of a few medications that we use to reduce anxiety and also help with pain control going forward. We start these the night before the procedure. They get it the morning of, and the experience is better for you. I think it's better for us. It's better for the pet, and they come in. They don't need as much pre-anesthetic medication. There's just a lot of benefits, and yeah, it's a big time difference when they get it versus when they don't. It's scary to come in and leave your family, and stay all day. So we try to make that as not scary as we possibly can, I guess.
Of course.
Yeah. So.
I'm old. I've been doing this a while now, and I remember the days when pets would come in. They'd come in for a spay, neuter, some kind of routine procedure, and they're,
Oh,
I mean, you can hear the crate rattling, and it's not until you see a pet like that come in that isn't on the medications that it triggers. You remember how it used to be, and we have to use more anesthetic. In fact, we just recently had a situation where, the owner didn't want to give the pre-visit pharmaceuticals. We absolutely had to use more anesthesia. We had more difficulty getting the pet under. Recovery wasn't as smooth as it normally is. So it really makes a big difference. On that note, though, when we do have surgery, particularly on cats, you can have some of those compounded into a transdermal, so you can put it on the cat's ear, particularly for gabapentin. I love this for my own cat because she's not thrilled about me putting, a liquid down her throat or anything like that. So it's something that can be compounded and put on the inside of the ear. So not only for surgery, but you can also use that for your visits as well. It improves the pet cooperation and allows us to have better diagnostics. We get a much better exam. It lowers the risk of injury to the staff, as we've mentioned before, and it reduces long-term stress. Case study, Christy, go ahead.
Oh, yeah. I just had a couple I thought really stood out as cases where we saw such a huge difference. And just, for privacy reasons, I've changed the names. But we'll say Dolly came in for a visit and needed blood work and urine. And Dolly was just absolutely very upset about her visit. So she was lashing out a bit at the staff, but also just not sitting still in any capacity. So we weren't able to obtain her samples, and she really needed those. We had to get those diagnostic results. So we sent her away with a, kind of low to medium dose of gabapentin, and we had her come back. So that visit was better, but still, we weren't able to get what we needed to get.
Is Dolly the cat?
Dolly's a cat.
Okay.
Yeah. And so poor Dolly. So we sent her away one more time. And I just say this because, it might seem like we're putting you through a bit of a situation. You have to come back a couple times, hopefully just once. But in this case, it was twice. We ended up increasing the dose and we found the sweet spot. We found like the perfect amount for Dolly. When she came back in, she was absolutely perfect. We got urine, blood, minimal stress to her, minimal stress to the owner. And now we know going forward what her dose is, what she needs. We had a dog who also was coming in, and we'll call him Max. So basically he did start pre-visit pharmaceuticals fairly early because he was showing a lot of anxiety during his appointments. So there was and things were going along fine. We were able to handle him. He was a little bit stressed and anxious, so he was muzzled for his visits, but the owner trained with him with a muzzle at home to kind of prepare him. But there was a day that they were very delayed, so they gave their meds at the time we had advised based on when their appointment was, but they ended up having to come in a few hours later. There was some delay that day. And by then their medication had pretty well worn off, and he was lunging at the staff, and it just ended up being more difficult than it needed to be. So I just mentioned that dog because we'll go over all the instructions when you get these. There are pretty clear instructions about when to give, and they are just to maximize the effect. If you're kind of outside of that range, you're going to have an effect. It just won't be as good. So we do try to put all that on your labels and go over all of it with you so that you know exactly what to do and how to proceed before you come in.
Very good. I was just remembering another case, and we were talking about it just before we came on, with a pit bull who had come from a rescue situation and was very difficult to manage. Always had chronic ear infections, and the owner was extremely open to working with the muzzle, pre-visit pharmaceuticals, and it took a while. It probably took close to 2 years, but you know what? By then, the dog was coming in, no muzzle, no nothing. Fortunately, got the ear infections resolved too, which is helpful. But I mean, it was such a 180 in this dog. It was a blessing to see, and the pet was a joy to see come into the exam room. So this is why we're talking about it. Guidelines for prescribing pre-visit medications and customization of the medication based on the pet's size, breed, and anxiety level. Like Christy had said, we typically start at a little bit of a lower, sometimes a little higher. These guys are great about being able, I ask them, because they do it so often now. I'm like, can you please go over this? Because they're so good at being able to tailor it to the pet. Again, though, we always want to start low. because every pet's different, just like every person's different. So, one pet may need a little bit more, one may need a little bit less. But I can't reiterate enough, it's a very safe product. So if they're getting a little bit more than perhaps is necessary, they're going to be sleepy. And then you know what? They're going to have a nice nap and everything's going to be fine.
Yeah.
We want to work with you guys. We want to work with you on the education and being able to get them to a point where we have wonderful visits, where we can get excellent diagnostics as far as our physical exam, and diagnostics as far as lab work, even x-rays. Oh, Lord, don't even get me started on,
Oh, yeah.
I mean, good Lord. You have a 80 or 95-pound dog who needs x-rays and is not interested in laying on their back, or, it can be a challenge.
Yeah.
So you can start to get an idea as to where these things can have a huge impact on the team. There are some, we get it. People are worried about giving medications. They say, I don't want to medicate them. I'm worried. I don't want to overdose them. I don't want them to be groggy. We need them to be. We that's the goal. We need them to be a little bit on the quiet side so that we can obtain this, until you use your behavior modification in order to get them to be a little bit more amendable. Again, it's happening more and more. We need to get a little bit more interactive with our pets with the behavior modification as well. The key is consistency. You've got to be consistent with this. I can't even tell you. I'm sure she can too. How many times we've had a pet come in, I didn't give him medication. You can just count on this being a stressful visit for you, a stressful visit for the pet, and the team. Oh yeah, please. So keep this in the back of your mind if you have an anxious pet, and it doesn't have to be that way. It doesn't have to be that way long term. We have these options available. Don't be afraid. Be educated.
And we do give you enough to give it a try, to see how it goes beforehand. Usually we'll give you several doses to give a trial run. But just be aware that when they're coming to us, obviously their adrenaline is going to override a part of that medication. So at home, you might be like, oh, he's asleep and perfectly relaxed. But if you're going to do a test run, you want to do something maybe that's a little out of their comfort zone. Go somewhere that they don't normally go, and kind of see how the response is. Because I think you'll see, like, once they come here for the visit, it's totally different. You'll be like, oh, it's like,
it didn't work.
It didn't work.
No, yeah, we just need to tailor it. It works.
It works. Just make those adjustments, and it's a lot better.
There was another thing I wanted to mention that was on here. Just see here. Oh yeah, there is a difference between sedation and mild calming. We don't want them coming in on a cart. Okay, that's not ideal for anyone. We just want them to be a little bit on the quiet side. And like Christy said, it sometimes takes some time to identify where that sweet spot is for them. So what is the future? When we're incorporating this in the behavior modification, when you're bringing your pets in, we want to combine the pre-visit medications with fear-free handling techniques. That's giving them the treats. That's, going slow, not just coming in and putting your hands on them immediately, especially if they're like cowering, and then using more soothing voices. A lot of the things that we have going on in the office are there for a reason, particularly our new cat waiting room. That needs to not smell like dogs. We have plugins in there. They need to be away from the dogs, because that anxiety level in them is getting worse and worse, as they're sitting there. So many of them don't live with dogs. And they're like, oh, what is going to happen to me here? The other part is communication. The techs here are wonderful about communicating with you guys. And a lot of times I think, if you've called or you've emailed, you had a technician call you back. They're very well versed. They have years and years of experience, under their belts, and they can answer those questions for you. So don't hesitate if you have questions about these things, or if you're watching this and you've never had the talk about these things before, or maybe your spouse brought them in and never mentioned it. It's important. So don't hesitate to reach out. Early intervention is the key. Okay, not that you can't work with these guys once they're at that super escalated level, because you can, but a consistency, starting early, and let's try to see if together we can get these guys to have a wonderful visit.
Yeah, I've had so many people say, he wasn't this bad last year,
Mm.
or, you know, or, you know, 2 years ago, he was fine. It's like last year he wasn't so great. And then this year, like we can't handle him. And it's just that. It's just there now that your pet is anticipating this really scary experience. And we try to get these meds on board before we get to that point.
Right.
So I think we've had really great success pre-surgically and pre-appointment wise. It's just a matter of, I think sometimes people feel like, you know, that am I giving my cat medication or dog medication that, you know, is there any danger to it?
Right.
You know, these are just really safe.
Honestly, I think there's more danger to not, because that long-term stress is having a lot of ill benefits to the pet, long-term benefits of chronic stress. Look, dogs aren't people, people aren't dogs, but the same premise for stress exists. So the longer you're under chronic stress, the more your body's going to suffer for it. And the reason why we're having this is because it appears to be happening more often. We want to make sure that everybody knows what it is, because, you know, sometimes you only get a small period of time when you're in the exam room or you're with the technicians, and, you know, we want you to be able to have that time for us to answer questions.
And we can answer some questions right now. And I see a few people have come in as you've been talking. So we are recording this, and you know, once I edit it, we'll have it available for a replay if you missed any of the beginning. But any questions?
Hello, whoever came in.
Just and unmute yourself if you are asking a question.
Oh, yeah, this is Bob. Sorry I'm late. Got
That's
stuck
okay.
at work as usual.
Oh, hi. How are you?
Yeah, yes, I have the anxious cat, Katie, who is on clomipramine. So and she gets so agitated if I put her in the carrier and bring her anywhere, including the animal hospital, that she just drools and slobbers all over herself. So I don't know if there's anything I can or should do. I occasionally try a pheromone spray in the carrier. It doesn't seem to do anything. But since she's already on clomipramine, I don't know if I would want to do any additional pre-visit medications to her.
Yeah, I think you'd be very happy with using something like gabapentin, and you know, particularly if you're already giving the clomipramine, you can use the two safely together as long as we manage those doses for you properly.
Oh, okay, good. Yeah.
That can really make the difference for you.
Mm-hmm. Yeah,
Thank
she
you.
scratched you the last time she was getting her claws clipped. So yeah, she just
Yes, sir. Yes, sir. It's part of doing business, but we like to have less of those.
Yeah. She doesn't even, she can't even tolerate when I pick her up. She panics. I
We were
think
just
she's
talking
never.
about the GI signs that you see a lot with cats when they're stressed. Like, you know, so whether it's drooling or it's having a bowel movement in the carrier, or, you know, that's a common one. So that just maybe reducing the anxiety could reduce.
You know, when you're coming in and your cat is open mouth panting, that is very, very bad. Your cat is stressed beyond belief, and it's dangerous for them because cats are obligate nose breathers. They should not be breathing out of their mouth, and if they're doing so, it's a problem. So that's just another area that you can see of anxiety when your cat comes in.
Yeah, I haven't seen her panting, but just drooling all over is what I see. So it'd be safe to give her a pre-visit gabapentin.
Yep, just give us a call, and we'd be happy to get that all straightened out for you.
Great, thank you.
You're very welcome.
We have another question that came in through chat from Ryan. Now, this is a good one. My cat will not allow us to pick her up, and we have missed appointments because we can't get her in the carrier. Could we use PVP to help, and how do we get them?
Okay. Again, the gabapentin might be helpful, particularly the transdermal for you. You just need to get near them to just wipe that on the inside of the ear. For a cat like that, I would probably do it the night before and also a couple of hours beforehand. And that might because for doing it the night before, they're going to be a little, this is what I have to do with Manfred, one of my cats. The night before, then the next day, it's not like I'm chasing him around the house. He's like doing a slow trot around the house. So it's a little bit easier to get him. And then I put the second dose on. Transdermal has worked amazingly well for cats. And I think that would be very helpful, Ryan.
I did speak to our one of the compounding pharmacies we use quite a bit. They can do a transdermal, and he also mentioned that that the oral medication can be mixed into food. It's not extremely bitter for cats. Some medications are, but I guess the gabapentin isn't too bad as far as adding it to food. But if it's just, your cat's can be onto it, then transdermal is like, you can't beat that.
Yeah, my cat fell for that once or twice.
Yeah.
No. It wasn't again, so.
Any other questions?
Hi, I have a question.
Sure.
It's Jody. I have Harley, Midnight, and Sammy, all cats, men.
Hi.
Hi. Midnight's actually here right now. And he's my feral. Remember my feral who's domesticated?
Of course.
Gabapentin works good. My question is for Sammy. So he is already on gabapentin twice a day, 50 milligrams for his fluted, but he's still open mouth panting when I bring him in. And I give him the gabapentin. What can I do? Because I know it's very stressful for him.
We need a much higher dose.
100?
Sammy needs a much higher dose.
Yeah.
My own cat, he's only about maybe 10 or 11 pounds. He gets 100 milligrams. My sister-in-law's cat gets like 150, like a ridiculous, and needs it. Maybe even a little bit more than that, but
Dolly got more than that as well.
Yeah. So I mean, it just depends on the cat. So 50 milligrams is not even close to the dose that we typically recommend for cats. It's almost always start at 100.
Mm-hmm.
I think I tried the last time giving him 100 to go into the car. I think he was still open mouth breathing. So, I mean, he lost a little weight, Dr. Bogier. He'd be very happy. He's 17 pounds. 14 ounces. He's getting there. So can I go up to like 150 then for him if I bring him in the next time, or would you stick to the 100?
Are you doing the 100 just the day of?
I'm doing 50 twice a day on a regular basis,
right?
Included. And then I did 100 the morning before he comes.
Okay. You may want to, 150 I would be okay with, but you can also do 100 the night before, and 100 the day of, okay. Or you can do, pardon?
I said, okay.
Yeah, just, I find in cats that extra dose the night before does seem to make a difference for them. It's not always necessary in dogs, but I've seen it in cats. And that's why people avoid bringing their cats in. And the longer you avoid it, the more you have a problem that's ongoing. It's just cats need their physical exams at least once a year up until the age of 5 or 6. And then they really should have it twice a year because we catch those things. How many times have you guys been in and I flip up their lip and I'm like, he's got an abscessed tooth, just did it yesterday.
Yeah.
Great client. She takes very good care of her cats. She has 2 abscessed teeth. You don't know because, cats are just very hard to show when something's going on until it's pretty advanced.
Oh, and they're so on to it. Like I think Ryan was talking about having difficulty getting his cat in the carrier. And, I had a cat in this very similar situation. I would have to get the carrier out 3 days ahead of time. Like if I didn't have it out, just so that my cat didn't hear the rattle of I think my cat knew, was like psychic, knew when I was near the closet. It was like, oh, you are on. Yeah, I'm on to you. So, so in that case, medication helped just take a little bit of that edge. They're just not as good of detectives once they have a little bit on board. So that might help.
They are also recommending, I know we're focusing a lot on cats right now, but they are also recommending with kittens. There's a lot that we're doing now, socialization and training and that sort of thing. But they recommend leaving the carrier out and allowing them to play in it, allowing them to sleep in it, putting catnip in there. But it's just not always conducive to people's decor, which I get. But those are some of the things that might be helpful too.
All right. I have another one came in through chat from Debbie. Says, hi, you have not seen my cat, but you have seen my dog Ziva. My question is that my cat can either be very sweet or the devil cat, and I don't know which he is going to be. I guess I don't know if they guess that he is the devil. Anyway, we travel to South Carolina, and I would love to give her something for the trip. What would you suggest?
I'm also thinking the gabapentin. I'm sorry. I know that it truly has been a game changer for cats.
Yeah.
We've started using it, at least in our practice, maybe in the last 4 or 5 years or so. but it has changed, revolutionized the, being able to manage cats when they come in. And, cats, that so many things go unnoticed in cats for a long time. So if you are going on a couple day trip like that, it's okay. We, again, no doorknob, no, but we can, though, get them to the point where they're a little bit like Manfred is on the 100 milligrams, where he's just like, okay, it's all right,
Good deal.
but that's,
Yeah, I think people used to think it was more like motion sickness related,
right.
rather than anxiety related. And it just, if you're a cat and you're indoors, 364, it's just a big day going out.
Just so you know, I'm going to be bringing her in. This is Debbie.
Hi.
Hi. She is a hermaphrodite, which hence the he, she.
Oh, gotcha.
Yeah. So when I took her to the previous, that one time she was great, one time she wasn't. And like they were going to have to sedate her. And then they didn't have to when I had to take her back. She was like an angel.
Perfect.
So I guess I heard you say something about because she doesn't take pills or really well or anything down her throat. I heard you talk about something that you could put on their ear.
Mm-hmm.
What is that?
That's the gabapentin. It can be formulated. It can be formulated into many, many different varieties.
Okay.
But the reason why I really like the transdermal in cats is because cats are so sensitive to taste, and they may eat it one day but not eat it another day. So yeah, I mean, and if you want, just go ahead and reach out to us. We will go ahead and get you hooked up with it prior to the visit. Even though we've not seen the cat before, if we know that you're coming in and we know that we have this issue and you're a previous client already, that's something I think that we'd be totally on board with.
Okay, great. Okay,
yeah,
thank you.
It's a little gel basically, and the process is it's a really tiny amount, so it's not like you're gonna have to dab a whole bunch of stuff on the ear. And you use a glove and you just wipe it on the inside, and it just absorbs through the skin, and they get at least a good portion of the benefits.
That would be perfect.
Gabapentin was originally designed as an anti-anxiety medication for people, but it caused too much drowsiness. And then we did find its use in pets, and it's been dramatic. I mean, we also use it for pain relief too, but it's really been a great product.
Okay, great. Thank you so much.
You're very welcome.
Mike has a question. Mike, you didn't type it out. Do you want to unmute yourself and ask it? Mike.
Yes, hi, this is Shraddha here. Shraddha Agarwal. Sorry, my name is displaying as Mike because I'm using somebody else's laptop.
There you are.
Dr. Borgir and Christy, I had this question. Actually, I have two questions for the gabapentin. First, is it contraindicated in any conditions?
Oh, sure. There are some reasons why you wouldn't want to use it, which is why typically we like to have that VCPR, which is a veterinary client-patient relationship, and know what medications your pet is on. Usually, though, when you're using it for situational problems, like we are talking about PVP, the pre-visit pharmaceuticals, it's okay to use. When you're using it on a more long-term basis, there are some interactions, particularly with other anti-anxiety medications.
Okay, thank you. And
You're
one
very
more
welcome.
question. With this gabapentin, will it affect their response to if they're having any pain, and will it affect being on this pre-med with their reflexes and also to elicit any pain? Will it suppress that during
On
the
the exam?
examination?
Oh, on the exam. That's a very good question. And that's difficult to ascertain, because if the pet is too difficult to do a proper exam on without the medication, then I don't know that we're getting proper information to begin with. Now, we're very good at being able to do certain things, particularly orthopedic exams, and finding, because cats don't really show pain very well on a physical exam. I'm always saying they don't talk to us, but they do. Their bodies are talking to us on that physical exam. So I think the greater good would be to be able to get the pet in without having all that stress level elevated. But yeah, that's a good point. You can have some suppression of the pain response, although it's much less so than if you were giving something like a non-steroidal or a true anti-inflammatory.
Okay. Thank you.
You're
We have a
welcome.
question from Patrick. What would you recommend for anxiety with fireworks?
Oh, fireworks.
Yes.
Oh, what is that one?
Oh, it's
Oh my gosh, it's awesome. It's fantastic.
Cilio. Is it Cilio?
Cilio, yay! All right, ding, 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 ding. So Cilio is a really good product. And when we were kind of earlier in the talk, we were talking about dexdomitor. Dexdomitor is actually an anesthetic agent. They've now created this for fireworks for pets, and it has also been a game changer. You wipe it on the inside of the gums, and it has made a huge difference in them. Every July, I think Barbara always puts up a video of my dogs. You can see all the fireworks going off in the background,
Yep.
and they're just sleeping, whereas before they were out of control. So yes, that would be something. We used to use a lot of different medications to help, trazodone and things like that. The problem is those take so long to take effect, whereas the Cilio, within 20 minutes is taken effect.
And it works after the event has started. So I think
Yes.
trazodone typically doesn't work as well once the event is underway, like there's already been fireworks.
Thank you.
Okay. Regina says, Dr. B, please let Joyce White Shepherds know about this med for fireworks. Dylan's mom. Does that make sense?
It does.
Yeah.
It does.
Okay. And Jody says, is this for cats too?
The Cilio, no,
No.
it is not used for
Didn't think
cats.
so. Okay.
I don't think we see as much noise anxiety. Well, I mean,
Probably because they just get scared and they
they
hide.
hide.
Yeah.
Yeah. That doesn't mean they aren't being stressed, but that's,
They're not in the tub, which I think dogs tend to travel to the bathroom for some
Yes.
reason.
Right. All right. Any other questions?
Bob, with a comment?
Yes.
Yeah, this Katie.
Aw.
Oh, hi.
Yeah, she's my special needs cat, the one with the anxiety issues. Even on clomipramine, she still poops to mark her territory. She's probably just doing that for Aggie's benefit, my other cat. But I did use gabapentin, oral gabapentin for Agnes before and after she had her teeth cleaned last year. And that worked fine for me. Although
Excellent.
transdermal might be better because she's pretty squirmy when I try to get any kind of meds into her mouth.
Yes, sir.
Yeah, Katie's very easy to pill. I tried the transdermal clomipramine with her.
Mhm.
Just
That's
plain
right.
didn't work
That's
at
right. I
all.
remember that now.
So I had to go back to the capsules, and those are working great. I'm getting them compounded now from PKS Pharmacy, and she's been doing
Yeah.
great on the capsule clomipramine.
Good. Yeah, every pet's different. S'mores, one of my cats, she gets an antiviral orally, and I literally just pop it down her throat. Again, though, Manfred, not so much. That's not not gonna happen.
Yeah, my cats are opposite. So Agnes might benefit from a transdermal gabapentin before visits, although she doesn't seem to get too stressed out. Katie's mainly the one who she gets stressed out even if I pick her up for any reason.
Understood.
And of course, they read your mind. They know when they're going to the
They
vet.
do. They know.
The transdermals, it's also good for the finicky eaters. Like even if it's not just about, not being able to administer an oral medication, or if you were thinking of putting it in food, but your cat's like super finicky, because they're so onto things. If they're eating something well, we don't want to sort of associate that food with anything different.
Yeah.
So I guess
Mhm.
that's another good reason, to try the good transdermal.
Yeah, you really can't fool them. You just can't.
No.
No.
Don't try.
And some cats will eat anything, but there's just some cats that just no. They have very high end taste.
Yeah, well, I'm glad Dr. B recommended clomipramine because previously, for a number of years on and off, she had been on fluoxetine and it worked, but it was suppressing her appetite. She was losing weight.
Right.
I don't get the side effects with the clomipramine on Katie.
Perfect. I'm glad it's working out for you.
Yes, it is. Thank you.
You're very welcome.
Anything else? Okay, well, I think this has been great. Thank you, everyone, for joining
Thank you,
us. Thank you,
guys.
Dr. B and Christy. Fabulous
Thank
job.
you.
And as I said, I'll get, do a little editing and I'll post this and send it out to everybody if you missed anything. And as always, we are here for questions and have a great night.
Thank you, guys. Thank you for
Great.
attending.
Thank you.
Thank you very much.
Thank you so much.
Thank
You're
you
welcome.
so much.
Thank you. Bye-bye.
Bye.